Hello everyone and welcome to Women's Health Goulburn North East's webinar on the Gender Equality Act. My name is Rachel McKay and I'll be your host this morning. To use an old saying, we think we might be the first cab off the rank to bring you this overview. And we hope this webinar will not only allay some trepidation that you may have, but that it actually inspires you to do the work or in the work, because as you know, everyone will benefit: our kids, our neighbours, our communities and our organisations. We are intersectional in our approach and are proud to stand beside generations of great women whose work has brought us closer to equality for all. We acknowledge the wisdom, living culture and connection of the traditional custodians of the unceded lands on which we work, and acknowledge the profound disruption of colonisation and the stolen generations on Aboriginal and Torres Strait Islander peoples. We believe in shared and just cultural transformation that embraces diversity, and these acknowledgements are part of the ethical principles that guide our work and our conduct. I come to you today from the lands of the Bangarang people of the Kulin Nation. So I wanted to talk a bit about what we do, Women's Health Goulburn North East. We're actually the specialist regional health promotion agency, and we're part of a statewide network of equity specialists, including a number of peak bodies. We focus primarily on primary prevention. As you can see there, we cover 12 local government areas. We focus on addressing the social determinants of health which impact equality. So economic empowerment, preventing gender-based violence and promoting sexual and reproductive health. The two new focus areas that we are looking at in our upcoming health promotion plan are mental health and of course climate change and disaster resilience. So to give you an overview of today, the purpose of today's presentation is really to provide an introduction to the Gender Equality Act 2020 by highlighting key concepts, how gender equality fits in the Victorian political context, and practical implications and considerations for your role as defined entities. It is our aim through this session to make the Act real, meaningful and relevant by translating the legislation from an abstract concept, by using practical examples of how you can apply the tools and resources to work towards gender equality in your workplace. Therefore, the presentation will be conducted in two main parts. So the first half will be focused on setting the context. So it's a brief background on gender equality in the Victorian and regional space, and how we've got to where we are today, including a brief overview of the obligations and timelines for you as defined entities. We'll have a question and answer session after that session, that first half. The second half of the presentation is really focused on making it practical. So by taking sort of a deeper look at the particular tools and activities involved in conducting a gender impact assessment, or what we call GIA, and developing and implementing a gender equality action plan. Along the way, you are welcome to ask questions or provide some comments. Just pop them in the question and answer box at the middle of your screen down the bottom. And at the end of each presentation, we'll have time to answer those questions, and we'll have a panel discussion and open it for further discussion as well. If you have any tech issues, you're welcome to put them in the chat box. So just a reminder, questions and comments in the Q&A, and any tech issues, please put them in the chat. So now, without further ado, I'd like to introduce you to our first part, setting the context. So I'm going to introduce Renata Lucas, who will be going through the key concepts of the Gender Equality Act 2020, and she'll actually talk through some obligations and timelines. So thank you, Renata Lucas.
Thank you for that warm introduction, and welcome everyone to the first part of our presentation. Before I even begin to talk about the Gender Equality Act, it's important to establish just what we mean when we talk about equality, and then how this is different to another common term in this space, equity. Often this is easiest to explain through images like this one, which some of you may have seen before and be very familiar with. So essentially, when we talk about equality, we are talking about the idea of sameness, equal shares of a pie divided by everyone. In this picture, all 4 people receive the same resource, a bike. At a superficial level, by giving everyone an equal share of the same thing, we may think that we have solved the problem. However, what the picture shows is that the idea of treating everyone the same doesn't work, as the bike only really fits the need of 1 person out of the 4. When we say that we treat everyone the same, we are often thinking about solutions from our own cultural and social positions. And what this fails to do is recognise that not everyone starts from an equal level in the first place. So here is where the concept of equity comes in. Equity is associated with the idea of fairness, and it recognises that individuals have different needs and start from different positions of advantage or disadvantage within communities. Therefore, solutions must be tailored and customised to be able to achieve the same outcomes. If we're giving everyone a resource, which in this case are bikes, then we need to be able to design these in a way that best meets the requirements of each of the individuals. And now we see that by doing that, all 4 people now have the appropriate resources to be able to participate equally. So overall, gender equality can be thought of as a destination. In the long term, we want to get there. We want to get to a place where everyone starts on an equal level. And then gender equity can be thought of as the process and that journey by which we get there. Recognising the differences and being able to build tailored solutions that provide equal opportunities. An equitable approach to achieve gender equality in the long term recognises that women have historically experienced discrimination and disadvantage on the basis of sex and gender. And these inequalities are one of the key reasons the Gender Equality Act has been introduced. The Act aims to acknowledge and address existing inequalities within society and workplaces and establish equitable practices and norms in our community. So now, looking at the Gender Equality Act, what is it? So it's a piece of legislation that is the first of its kind in Australia, and it's a once-in-a-generation opportunity to improve gender equality in Victoria. So we're pretty excited about that one. The Act itself and its principles are aspirational. We're aiming for the equality of rights, opportunities, responsibilities, and outcomes between people of different genders. Specifically, by requiring accountability and transparency and setting measurable targets and quotas, the Act makes working towards gender equality an achievable goal for those in the public sector. The Gender Equality Act applies to organisations of 50 or more employees in the public sector, and that also includes universities and local governments, among others, referred to collectively as defined entities. So these entities have obligations under the Act to improve workplace gender equality specifically by taking positive action, which refers to completing workforce audits and developing a gender equality action plan and strategy, and considering gender equality in the policies, programs and services that directly impact the public by completing gender impact assessments and publicly reporting on progress through the Commission for Gender Equality in the Public Sector website. So these obligations will be covered in further detail a bit later. But first, what are some of the intended benefits, not only for your organisations, but also to the broader Victorian community? The principles of the Gender Equality Act acknowledge that gender equality benefits all Victorians, regardless of gender, and that it's a human right and a precondition to social justice. gender equality also brings significant economic, social, and health benefits for Victoria. Some of the key economic impacts are highlighted here on the slide, and so I'll just go over a couple briefly. From a growth perspective, the International Monetary Fund estimated a 35% increase in gross domestic product may be possible if the gender gap in employment was closed. And research by the Workplace Gender Equality Agency found that companies that increased the number of women in leadership positions, such as CEOs, board representatives, and key managers, also increased their market value by 5 to 7%, which equals around $80 to $100 million. On the other hand, those that decreased the number of women in leadership positions reduced their market value. If we look at some regional data from our area in the 2016 census, we can see that despite more women overall holding post-secondary qualifications, that this doesn't necessarily translate into equal ratios of women and men in leadership positions. So under a third of chief executive, general managers and legislator positions in the Hume region that we cover are held by women. We also know that when workplaces are equally appealing to women, men and gender diverse peoples, that organisations have then access to a larger talent pool. Employees value positive workplace cultures and environments that offer gender equality policies and practices, flexible working arrangements, and support for employees with family and caring responsibilities. Looking again at the regional data in Hume region, 69.2% of males work full-time in comparison to 39.5% for females. So considering and adopting more flexible models of work can translate to reduced staff turnover with benefits for all staff, not just women. If we have a quick look here at the social impacts of gender equality, we see that there are significant opportunities for increased social inclusion and community cohesion, as the evidence shows that the more unequal a society is, the higher the rates of antisocial behaviour and violence. And if we're looking at the workplace sexual harassment, there's reductions seen here with better gender equal workplaces. And we've seen surveys on employees that have experienced harassment found that it greatly affected their mental health and self-esteem, impacted their employment and also their relationships with their partner or family. And from an organisational perspective, workplace sexual harassment reduces workforce morale, it increases absenteeism and staff turnover, and may have significant legal ramifications. So Women's Health Goulburn North East, we've been operating for over 2 decades with a core focus on advancing gender equality, and we've been involved in many partnerships with regional organisations like yourselves over the years to improve the health and wellbeing outcomes of rural women and girls. And we've seen over this time political priorities fluctuate and change, but never before have we experienced the significant social groundswell and interest in achieving gender equality as we have today. So how did we get here? Unfortunately, it began with a tragedy, but also in that tragedy, it was the leadership and voice of Rosie Batty that propelled government to act and conduct a royal commission into family violence. In March 2016, 227 recommendations were handed down, which included the expected focus on service response and reform, but also it highlighted the urgency of setting up structures and policies to prevent violence from happening in the first place. The Royal Commission showed that Victoria needs to address gender inequality in order to reduce family violence and all forms of violence against women. So in response, Safe and Strong, the Victorian Gender Equality Strategy, was developed by the Victorian government in 2016, and that was part of the statewide vision to prevent violence against women and embed communities of respect and equality. And it was here under Safe and Strong that the government committed to legislative change to promote gender equality. Then the passing of the Gender Equality Act in 2020 was the landmark moment that recognised the power of legislation in influencing social norms, cultural expectations, and popular attitudes, as well as policy shifts. The Act specifically aims to improve workplace gender equality, which is achieved when, regardless of gender, people can access and enjoy the same rewards, resources, and opportunities. And workplaces are where many people spend a great deal of their time. And so they've been particularly identified for the potential to support progress towards gender equality. The leading national prevention organisation, Our Watch, explains the ways in which the social structures, the norms and practices, including those within workplace settings, operate to either reinforce or challenge gender inequality, and it's through those everyday conversations, policies and actions. Workplace policies and practices can perpetuate gender inequality from unconscious bias in recruitment and promotion processes to the types of images used in marketing materials that might send subtle messages about the type of people that are expected to hold different jobs. On the other hand, workplaces can also be a powerful agent for driving social change by developing policies and practices that proactively support women and men to undertake flexible work arrangements to better share care responsibilities and unpaid work at home. And then this also has a flow-on effect and opens up pathways for women to be able to enter more senior leadership roles. So there is great potential for workplaces across Victoria to be part of this large effort to achieve gender equality. And also it recognises that many of you may already have been working in this area for some time and have developed some great practices that can be further modelled and publicly promoted through the Act's obligations. We've covered a lot of the background information, but in practical terms, what is it that your organisation needs to do? All defined entities will have to make measurable steps towards gender equality in the workplace and promote gender equality in all policies, programs and services starting from the 31st of March this year. There are 4 key steps to the Act, which I'll go over very briefly, as these will also be covered in further detail in the second part of our presentation. So the first one, by the 30th of June this year, defined entities are required to undertake a workplace gender audit to identify gaps and collect disaggregated data on indicators such as pay gap, workforce segregation, recruitment processes, flexible working arrangements, and sexual harassment. In step 2, by the 31st of October, your organisation will need to prepare a gender equality action plan that is made publicly available and includes strategies created in response to the findings of the workplace audit and has also been developed in consultation with your relevant stakeholders. Along the way, when creating or reviewing policies, programs or services that have a direct impact on the community, organisations must conduct a gender impact assessment, and this assessment is designed to provide insights and demonstrate how the policy, program or service will meet the needs of people of different genders and benefit all potential stakeholders. And the final step is to submit a progress report every 2 years on the 31st of October. This progress report must demonstrate tangible actions taken towards gender equality, improvement on gender equality indicators, and the implementation of strategies set out in the Gender Equality Action Plan. As part of the requirements in auditing and developing gender equality action plans, entities must consider the gender equality principles contained in the Act, including those that recognise intersectional gender inequality. The Act's principles outline that all human beings, regardless of gender, should be free to develop their personal abilities, pursue their professional careers, and make choices about their lives without being limited by gender stereotypes, gender roles, or prejudices. But the Act's principles also acknowledge that gender inequality may be compounded by other forms of disadvantage or discrimination that a person may experience on the basis of attributes such as Aboriginality, age, disability, ethnicity, gender identity, race, religion, or sexual orientation. Coined by Kimberly Crenshaw, the concept of intersectionality seeks to identify and make explicit the multiple sources of oppression that may disadvantage an individual. And these sources of oppression interact together with each other and may include some of the attributes that are included on the image on the slide. Often when we are looking to understand differences in health and wellbeing outcomes between genders, we may analyse data of two groups, which risks treating each group as homogenous. And what this intersectional approach seeks to do is then interrogate the differences within population groups, which can best be understood, often through lived experience, by ensuring that the voices of these people are included in planning processes, so as to ensure that strategies developed do meet diverse needs. And it is a strong recommendation from the Commission to include an intersectional approach when completing your obligations. That takes us to the end of part one of the presentation, and now we will regroup for some question and answer time. Thank you.
Welcome back, everybody. Thank you, Renata. That was fantastic. I'd just like to introduce you all to my panelists here, my colleagues, Renata. Hi, Renata. And Amanda. Hi, Amanda, our EO, and Casey, who'll be our next presenter, who I will also introduce. So we have a couple of questions in the Q&A. The first one is from Lisa, and I think it'd be great to answer this live. Amanda, I'm going to go to you on this one. And the question is, I wonder why this is called the Gender Equality Bill. Is it to implement equity or realise equality?
Yeah, thanks, Rach. Look, I think what's happened is we've stated our goal, and our goal is equality, and the Act gives us the tools to get there, essentially. So if we think about Renata's bicycle explanation earlier, I think that really shows it, and we are looking for equality at the end of this so that we can all start from a level playing field at a point in the future.
Excellent, thank you. There was another question around COVID and the impact that we've seen emerge in flexible workplaces. Amanda, would you like to comment on that one as well? And how might this actually fit with the Act?
Yeah, sure. Look, and it's another one, Rach. I think when we talk about gender equality, we're talking about equality for everybody. So what we want to do is have everyone have the same opportunities. And unfortunately, as you know, women are impacted by gender stereotypes, and so are men. So one of those is that women are seen as the ones who do a lot of the unpaid labour in our society. They look after children, they care for family members, etc., and that men go to work. So what this leads to is women often not even having the opportunity to return to work, say after the birth of a child, as soon as they might want to, whereas some men are really interested in staying home and actually looking after children. But the thing is that there's not a lot of opportunity for that, there hasn't been opportunity for that. There are some workplaces that are really forward thinking in this, but I think that what the Act does is allows us to look at, well, what are the situations in our workplaces, and should we be looking at our policies around, particularly, for example, around parental leave, and what's our workplace culture like? You can tick the box and you can change the policy, but if it's still a matter of joking for men, for example, to want to stay home and look after the children and babysit, then you're not going to get a positive outcome. So yeah, so that's been one of the things that's certainly been raised in COVID. I'd be interested to hear what other people have to say about that.
Yeah, I think particularly the way that we've had to adapt to a remote working environment for a lot of the workplaces that haven't been able to have people physically in the office, and put on the added burden of the remote schooling for, I cannot imagine, hats off to everyone that has had to juggle that as well, because it's just, it's just thrown us into an incredible situation, but at the same time, it's a real opportunity to shake things up and really think about what does a flexible workplace look like, and what are the opportunities for all employees to be able to, just better negotiate, I suppose, that work-life balance, because it's always intertwined. And yeah, so COVID has given us that a real look, opening up of how it's actually possible for men as much as women to be able to work flexibly in that space. So yeah, really interesting.
I think, Renata, really what you've both been talking about is that the notion of the norms of an organisation versus the practices and also the structures. And I think it's really important for defined entities to really understand what is a norm in their organisation and how does that actually play out in practice, and what structural barriers are there as well. So that was a great overview that you really set the context there, Renata. I've got another question for you, Renata. It's I think it's Lisa again. I did read somewhere that some of the data will be collected through the People Matters survey. Is that the case?
Yes, so I'm looking off the Commission website and the resources there. So I've got the Workplace Gender Audit guidance that Casey's going to talk to in a little detail later. But for that specific question, the employee experience data is going to be collected through the People Matter survey. So defined entities that already do this as a matter of routine, they'll get that data from the Victorian Public Sector Commission. For those defined entities that don't normally do the People Matters survey, there is an opportunity to be able to work with the Victorian Public Sector Commission to be able to get them to survey on your behalf. Otherwise, they can also provide a survey tool for you to do it in-house. So yeah, that's all the details that is in that guidance that you can go to and look at a bit more if you're seeking out that information.
Excellent. Thank you, Renata. We do have another question, but I'm going to put that other question at the end of our next presentation. So without further ado, I'm going to actually introduce Casey McDonald, who will do our next presentation. Casey's actually going to do that piece around making it really practical. So looking at our process, looking at the steps to implementing the Act, gender impact assessments, etc. So here we go, Casey.
Women's Health Goulburn Northeast has been working with partner organisations across the region for over 2 decades. We have a deep understanding of the regional context and a strong connection to our communities. And we're proud to stand alongside our partners and stakeholders as they deepen their commitment to gender equity work under the Gender Equality Act. When you engage with us, we'll assign one of our expert team members to be your key contact, facilitating a long-term relationship built on trust and mutual learning. We'll help you to scope your organisational context and take stock of where you're at on your gender equity journey, so we can develop a unique whole-of-organisation approach that fits your organisation and your community. Your key contact will act as a gender equity mentor and will be available to offer support, tools, resources, and advice when you need it, and help to capacity build your organisation and team to carry this work forward in a way that's efficient, sustainable, and transformational. When it comes time to carry out your obligations under the Gender Equality Act, we'll support you to navigate the process and direct you toward the Action for Gender Equality Partnership. This is a network of 14 gender equity organisations with a combined total of 40 years of experience. Under this partnership, you can access resourcing for gender equity work, request a quote for service, and nominate Women's Health Goulburn North East as your preferred provider. If you choose to work toward your obligations under the Act in-house without accessing funding from the Action for Gender Equality Partnership, we'll still be available to offer continued support. Now that I've talked you through our partnering process, we'll look a little bit closer at the practicalities involved under each of the 4 requirements of defined entities under the Act. Firstly, you'll be required to audit your workplace to work out where your organisation sits in terms of gender inequality. What is the current state and nature of gender inequality within your workplace as of the 30th of June 2021? The information gathered in the audit really supports your organisation in determining how existing systems, structures, policies and practices are promoting gender equality in your workplace. It will also help you gain insight into where you need to go next, meaning you can allocate your time and resources to the right things. The Act requires that this audit looks at data related to particular gender equality indicators. There's 7 indicators, and they are the gender composition of all levels of the workforce and of governing bodies, which your HR department should be able to provide. Equal pay for work of equal or comparable value across all levels of the workforce, irrespective of gender. Sexual harassment in the workplace, including the number of reports. Recruitment and promotion practices in the workplace. These are things like policies, hiring, and interview practices. Availability and utilisation of terms, conditions, and practices relating to family violence leave, flexible working arrangements, and working arrangements supporting workers with family or caring responsibilities, as well as the gendered segregation within the workplace, which means the gender composition of your workforce by occupation. As we mentioned earlier, it's really important when meeting your obligations under the Act that you consider intersectional gender inequality. For the workplace gender audit, this means collecting and analysing data that not only looks at gender, but at other intersecting factors that may compound inequalities, like age, aboriginality, disability, ethnicity, gender identity, race, religion, and sexual orientation. On the Commission website, you'll find a guidance document and reporting template with comprehensive instructions on conducting the audit. Please note the template will be updated when the Commission has developed its reporting platform in 2021. The Workplace Gender Audit provides really awesome baseline data where critical gaps, areas for improvement, and challenges are uncovered, and forms the basis for the development of your Gender Equality Action Plan, which takes us to Step 2. Under Step 2, you need to develop a Gender Equality Action Plan every 4 years. And think of this as a roadmap that shows where you are, and you know this now because you've done your audit, and where you plan to go from here. This plan needs to include the results of your workplace gender audit with any personal or potentially identifying information removed. This gives an overall assessment of gender equality in your workplace. The action plan will also need to include strategies and measures that your organisation has developed in relation to these findings. I guess the key question here is around the development of these strategies and measures. How do you make sure they're both meaningful and achievable? What does the data tell you about where you need to go and how will you get there? Who will be involved? What are your timeframes for success? How will you know when you achieve it? These are all important questions to consider when developing your action plan, and we encourage you to think big. Gender equality has benefits for everyone across a range of social and financial domains, so aim high. The Commission clearly outlines a recommended process for the development of a Gender Equality Action Plan, a process that has 6 key steps. You can see them here. We've got a baseline gender audit analysis, as we talked about in Step 1. Then we've got meaningful consultation and engagement. So this is with your governing bodies, employees, representatives, and other relevant people to help develop your action plan. You should make sure to consult with people who may experience compounded disadvantage on the basis of gender and other social identity markers, employees at different levels of employment and employment types, peak bodies, and local women's organisations. What will this look like for your organisation? You can conduct surveys, focus groups, interviews. What's really important here is making sure that you prioritise the safety and well-being of those you're consulting with throughout the process. Make sure you've got appropriate support mechanisms in place prior to consultation and that they're clearly communicated. Do you have an EAP, a supervision process, or external referrals to appropriate support organisations? The case for change. How has your organisation considered the gender equality principles in the Act in preparing your gender equality action plan? You'll need to clearly state your organisation's commitment to these principles and how you've used them to inform the strategies you are including. Strategies and measures. These are grouped according to the indicators, and based on your audit and consultation, you'll need to set out your strategies and measures in your plan. And remember, you need to publicly report on reasonable and material progress towards gender equality via these strategies every 2 years. Leadership and resourcing. As I'm sure you're aware of by now, meeting your requirements under the Act is quite resource intensive. So considering factors relevant to your organisation, like the number of employees and any barriers to progress, you'll need to outline how you'll be appropriately assigning resources, including staff and budget, to implement the strategies in a strategic resource plan. Measuring progress. To work out whether your action plan is achieving positive change, you'll need to monitor, measure, and report the outcomes of your actions every 2 years. Under each of these steps, there are elements that are required and others that are recommended. The recommended elements are optional under the Act, but we'd really like to take the time to highlight how important these recommended items are, particularly those relating to intersectional inequality in your workplace, those around accountability and timelines, and the inclusion of best practice informed strategies. So what does this mean in practice? Let's have a look at a case study of Port Murphy Tafe. After conducting a gender audit as part of their obligations under the Act, the team at Port Murphy identified significant room for improvement across a range of workplace indicators, most notably related to the gender composition of their workforce. The data highlighted that women were underrepresented across all senior leadership levels and that there were low levels of workplace diversity. So what does this data tell us about the organisational environment at Port Murphy Tafe? Does it give us any insight into workplace culture? Why are there so few women in leadership positions? How can the workplace be diversified to include greater representation from Indigenous and other local communities? These are all questions you'll need to consider when developing strategies in your gender equality action plan. You can gain insight into these questions by considering things like recruitment and retention policies, flexible leave policies, maternity and paternity entitlements, HR reports, and through consultation with a wide range of internal and external stakeholders. To develop relevant and place-based gender equality strategies to address poor workplace indicators, Port Murphy Tafe engaged employees, governing bodies, and other representatives, including Aboriginal and Torres Strait Islander men and women, to understand the local context, identify potential barriers and enablers, and to support the development of responsive strategies that meet the needs of all people in the organisation. During this consultation process, Port Murphy Tafe identifies that women experience unique barriers to career advancement within the organisation, because there's an expectation people in leadership positions will work overtime and refrain from taking flexible and parental leave. As women are often primary caregivers for children and shoulder the majority of unpaid domestic labour at home, it becomes clear that the existing workplace culture prioritises male leadership and prevents women from advancing beyond junior roles. The consultation also uncovers a network of existing local Aboriginal organisations in the community that they're yet to build relationships with, where they can network with Aboriginal and Torres Strait Islander women and improve culturally safe practices within the workplace. After analysing the workplace gender data and consulting with key stakeholders, Port Murphy Tafe will need to develop a gender equality action strategy that highlights how they'll make progress towards improving the current state of gender inequality under the indicator related to the gender composition of their workforce. They'll also need to consider how will they know if the strategy is working, who's responsible for implementing the strategy, how much resourcing will be required to achieve results, and the timeframes for working towards these outcomes. This process will form the basis of how they'll develop strategies for each indicator under their gender equality action plan. Now let's look to step 3, gender impact assessments. Gender impact assessments must play a key part in the development and review of all policies, programs, or services that have a direct and significant impact on the community. For local governments, this means looking at the gendered impacts of infrastructure projects like roads, paths, and lighting, waste collection services, sports facilities, as well as those broad plans and strategies like council plans and municipal public health and wellbeing plans. For TAFEs, the community includes the student body and means you need to consider the gendered impacts of student support services and other infrastructure development. For Victorian public service agencies, this means looking at legislation development, policy guidelines and frameworks, budget bids, and awards programs. Gender impact assessments are vitally important for promoting gender equality in the community because often women and gender diverse people do not have the same access to decision-making processes, resources, and other opportunities as men do. A GIA provides you the opportunity to answer 4 key questions. Does this policy, program, or service do everything it can to ensure resources are distributed and used equally? Does it consider the different needs of people of all genders? Does it benefit some people more than others because they have greater access? And does it have the potential to influence broader social norms and gender roles in society? So there's 4 key steps in the GIA process. 1, define the issue and challenge assumptions. So this one's about asking the big questions like, what kind of gendered roles and responsibilities do community members have? How do these roles and responsibilities influence their access to our services, programs, and policies? And what unique needs do people with a disability or people from different cultural backgrounds, age groups, or sexual orientations have? And what assumptions are we making? Number 2, understanding the policy context. This is asking you to consider the available information from organisational data, desk-based research, and stakeholder consultation to uncover how your decisions may affect different people and to identify best practice examples relevant to your area. Number 3 is an options analysis, and this gathers all the data from step 1 and 2 and weighs them up based on potential positive and negative outcomes. You want to identify which option is best able to meet the needs of all people and ensures the equitable distribution of resources. Do any of the options have unintended consequences? Do any of the options actively exclude people? This is your chance to explore all roads ahead before making a decision. Number 4, final recommendation. Here you'll make a final recommendation for a way forward, justifying why you've chosen this option and how you'll mitigate any unintended consequences. The Gender Equality Commission website provides a comprehensive best practice toolkit for when and how to conduct a GIA. Every 2 years when you submit your Gender Equality Action Plan progress report, you'll need to clearly outline all of the GIAs you've conducted within the reporting period. So it's important to follow the process and keep good records of any consultations undertaken. Although it can seem like a lot of work, the steps outlined in a gender impact assessment are designed to support organisations to improve their workplace practices and strengthen positive outcomes for their stakeholders and their community. Applying a GIA to the scenario here may uncover a range of relevant factors that can guide policy and decision making and enrich the student placement experience. Let's assume that after reviewing the available demographic enrolment data for the diploma of community development, the HR team uncovers a high proportion of students who have identified as Aboriginal or Torres Strait Islander on their enrolment form. The team also finds that over 80% of students identified as female and 2% identified as non-binary. After conducting a brief desk review of the available literature on workplace barriers for young people, as well as people from diverse backgrounds, the team decided to hold a voluntary focus group discussion for students enrolled in their diploma to understand what's preventing them from enrolling in their student placement program. In the focus group discussion, the students discussed workplace bullying and harassment and safety while getting to and from placement as key areas of concern that put them off enrolling in the program. Using all the information they've gathered in step 1 and step 2, the HR team put together a range of options for strengthening the student placement policy. They consider the costs and benefits of each option from both a resource and a social perspective, and they explore any potential unintended consequences. In the end, the team decided to include a workplace audit progress in their new student placement policy. So before students are placed into workplaces, the HR team conducts an audit of the placement organisation to ensure they have robust anti-bullying and anti-harassment policies, are culturally safe workplaces, and have appropriate facilities for trans and non-binary students. Since the rollout of the new policy, student placement enrolments have increased by 40%, and they can report on this in their progress report to the Commission. Under the Act, you'll need to submit your progress report to the Commissioner every 2 years. And these reports must include what policies, programs, and services were subject to a gender impact assessment. What actions did you take as a result of your gender impact assessment? For example, did you change your initial plans for your aquatic centre redevelopment because of the gendered impacts you uncovered through a GIA? Your progress in relation to the measures and strategies set out in your Gender Equality Action Plan. For example, have you been able to successfully implement advancement pathways for Aboriginal and Torres Strait Islander women within your organisation? What does the data tell you? Your progress in relation to the workplace gender equality indicators. Has the number of women in your governing body increased since your initial workplace gender audit? All of this provides valuable insights into the progress you've been able to make towards gender equality within your organisation. Now that we've covered your key obligations under the Act, I'd like to talk you through the Action for Gender Equality Partnership. Women's Health Goulburn North East, along with 13 other organisations, are a member of this partnership. The Action for Gender Equality Partnership is a member of the expert panel of providers for the Commission for Gender Equality in the Public Sector. Members of the Action for Gender Equality Partnership support public entities, corporates, and the not-for-profit sector to improve gender equal outcomes and accountability. And under the panel of providers are considered a trusted supplier that can be engaged to provide advice and training that will support you to conduct gender impact assessments and develop gender equality action plans. As a collective, the members of this partnership are leaders in gender equality with over 40 years of expertise and experience. We're respected for our tailored gender equality services, supporting organisations and workplaces at any stage of a journey of transformation. So you can also ask us about workplace gender audits and evaluations, gender equality training and development, promoting gender equal health and safety, the prevention of gendered violence at home, work, and in the community, and setting gender targets and quotas for proven impact. By engaging with us through the Action for Gender Equality Partnership, you'll have access to expertise from 14 expert organisations across Victoria. So you can engage members of the partnership, including Women's Health Goulburn North East, by contacting GenVic via the contact details on the slide. So that's genvic@genvic.org.au. Although this work might seem overwhelming, there's a lot of support out there to help defined entities meet their requirements under the Act. Like I've mentioned, there's comprehensive tools available on the Commission website, and there's virtual roadshows coming up over the next couple of months where you can meet the Commissioner, Dr. Nikki Vincent, and learn more about how the Act applies to entities in different sectors. Women's Health Vic have online micro-credentials to help build your capacity in understanding and applying gender concepts, like applying a gender lens, which will be useful for building skills in applying a gender impact assessment. And again, there's specialist and technical support available from the Commission's appointed panel of providers across a range of topics related to meeting your requirements. So this includes auditing, applying GIAs, developing strategies, evaluation, IT systems support, and mediation and conciliation.
Welcome back, everybody. Casey, thank you. That was an awesome presentation, and I really hope that it's really made things practical for the defined entities and everyone joining us today. It was great how you outlined the requirements, but also how to access the panel of providers. So, and we're all there to assist you, so don't hesitate in reaching out. The other one I loved, Casey, was aim high, everybody.
Yeah.
Aim high. Thank you. So I've got a couple of questions. The first I'm going to throw to Renata, actually. This one says, have you been meeting with organisations to start these conversations? For the locations you cover, how ready do you think we are across the region?
Thanks, Rachel. Yeah, the short answer is yes, we have been meeting with some organisations, and it's a lot of ongoing partnerships that this is part of our kind of business as usual, our core work that we've done over a number of years with key partners. So we haven't been going out and targeting specifically and sitting down about the Gender Equality Act. Often it's been coming up, organisations have come to us about other things, and it's come up in conversations over the past 12 months or so since it was announced. So given that it's coming a bit closer to the 31st of March and the start for the defined entities, we're getting a lot more queries and questions about just thinking through the practicalities. And in terms of that readiness, from our meetings with the partners that we have had some time with, it is varied. I know that there's a huge number of organisations, with some are huge, with a huge workforce, and others are small, at that 50 or more, and there's that, it's a big difference in capacity and resourcing to be able to meet it. Some have gender equality action plans already, and others are only at the start of thinking about it. But I suppose the takeaway is that you can always start somewhere, and we're here to help. And we're here to just have that conversation to start with, and have a look at, just the context of where your organisation is sitting, and we're happy to just give you some little pointers and think about, where your workforce is, and where you can take it from there to start. It's a bit of a transitionary period as well. Like, it does start on the 31st of March, but I get the sense that there's not an expectation from the Commission that everyone's going to be experts in this and is going to take it from the 31st of March and go. It's that it's working towards it. They're wanting to see that intention of wanting to meet those obligations. So I hope that that's answered that question.
That's a great reply, Renata, and I think that's that thing, isn't it? It's about that intention. I've got another one here. Is there a cost? I'm just going to go up a bit. Is there a cost to establish this partnership to help us meet our requirements? Does anyone want to answer that one? I won't pick on you.
All right, I'll do that one, right? So I think Women's Health Goulburn North East and our colleagues, sister organisations, have been around for coming on 30 years now. So we're here in the region, and we're here as a resource to support people with information and to help you get on your gender equality journey. The reality of it is, and it ties in a little bit with what Renata was talking about before, is that we have 8 staff to cover a fifth of the state. So we can't always be there in person or even online in person to support organisations individually. But what we can do is provide this sort of free webinars. We've got a lot of resources on our website, and we'll be adding more to our website. And also there's the work with the Commission. So the Commission's website as well. So I guess we'll provide as much as we can as part of our business as usual sort of work. When it comes to the Action for Gender Equality Partnership, which Casey mentioned earlier, this is us joining in with our sister organisations. So we're statewide, so we have a lot more resources to draw on. And we're also a member of the panel of providers for the Commission. So there are 24 providers that can support organisations to enact their obligations under the Act. So the way that works is that people go to the Commission saying that they would like support, and the Commission has funding who will then pay us or the provider who's been selected to provide the work, and pay us to do the work for you. So there is I think that answers one of the other questions that's there. There is some funding from the Commission, but basically we're here. We're going to be here. We've been here for 30 years. We're just going to keep being here to support you in that more generalised context to the extent that we can. given how many staff we have on board. So if you don't want to go, if you do have funding and you don't necessarily want to go through the Commission's process, then certainly come to us and we can work out a quote, and we can work out something within your budget that works for you. So I hope that answers that, and I think there was a couple of other questions. Is there anyone else that wants to add to that?
There was also a question around, are all businesses expected to complete these steps? You know, a family-owned business to major enterprises. Casey, would you like to answer that?
Yeah, I think there was another question about that as well. Yeah, so it just applies to the public sector, so not small businesses. What was the other example they gave?
To large entities.
Okay, yeah, so it's just the public sector, and there is actually a list available, I think it's on the Commission website, that lists all of the entities that are covered by the Act, and we can send that out with the resources after the webinar as well, just so you can access that and see who's on the list.
Terrific. We will be sending out this resource afterwards to people who have registered. So just a final question, and happy to throw to anyone here. It's a good question. We may not be able to answer it to Lisa. There's so much work going on in this space with MARAM reforms and now gender equality. In your opinions, could both of these bodies of work be rolled into one implementation group? I'm interested in your thoughts here. I'll give you 1 second to think of a reply to that.
Look, I think Renata and I have actually been discussing this, and I'd like Renata to talk a little bit more about it too. But when you do need to develop your gender equality action plan, there's nothing to say that action plan has to be a completely separate document or a separate piece of work. It needs to consider, gender equality considers all of the things that you do. When you present that plan to the Commission, they'll sign off on it or not, or give you suggestions around it. But the fact is that it can touch all the different areas that you're undertaking in your workplace. Renata, will you?
Yeah, Rachel, you're probably more familiar with the MARAM framework, but yeah, just going on from what Amanda said, that is thinking about developing plans, it is around that workplace context. So it's about the staff, and for some of the defined entities, it's about the student bodies like the universities and that type of thing as well. So it's about your direct stakeholders and your staff and employees. So yeah, we've had a few other questions around like public health plans, whether they can be rolled into an action plan. But yeah, where they're public facing, it's quite a separate, I suppose, purpose. So yeah, I'm not sure, Rachel, what your thoughts are around the MARAM tool there.
Yeah, it's interesting because it's certainly response versus gender equality, gender equity. I don't really have a stance on it, but yeah, thank you for that, both of you. I'm just conscious of time, and I've got a last really good question that I want to get through and throw to Casey. It says, I have already completed a workplace survey where we were asked to identify communities of practice. Is this something that Women's Health Goulburn North East are going to lead for our region?
Yes, so Women's Health Goulburn North East will be running a community of practice, and it's a gender equity community of practice. And the first one is on the 4th of March. And I think majority of people here have probably been sent an invitation, but if anyone is interested in joining that, you can get in touch with us. I think the next slide is going to have our contact details. So yes, we are leading the COP.
Excellent, thank you for that question too. Thank you to our panel. I'm going to pull it in there. Yeah, awesome hour, and I really hope that it's inspired everyone participating today. Thank you for your questions. I'd like to really reach out and make sure that you aim high, as Casey said. Just a reiteration that for those who have registered, we'll be sending you out the link to the recording. So please share it to your teams and get them engaged with the work. Don't hesitate to get in contact with us. And particularly if you have any unanswered questions, reach out to us and make sure you follow us on socials as well, everybody. Thank you so much, everyone. And let's go for it.
Thank you. Bye.